I'm Mort Cooper, your host on Change Your Voice, Change Your Life. Subtitled today, What's Wrong with Your Voice? We have in studio Sylvia Cheek. She joins with me because she has a condition called the strangled voice. The strangled voice. You've heard about it before. It's when you have difficulty getting the words out and the sound isn't right. Let's hear what it's about. How long have you had this problem with the strangled voice?
I've had it for 34 years.
You've had it for 34 years.
Yes.
You're a young lady. You must have had it when you were very young.
Yeah, I think it started when I was about 18.
18.
Yes.
What happened? Do you recall?
Well, first of all, it was an automobile accident that caused some head damage. I had a tonsillectomy. I developed a horrible virus. I was sick for about 4 months. And then I lost my voice.
How long did the virus last?
About 4 months.
Did you notice the voice changing?
Yes. And I went for speech therapy. And immediately, because I was in college, was in my last year, and I wanted to get into my student teaching.
Mm-hmm.
And I wouldn't be able to do it with that. And so I consulted a speech pathologist.
What did they tell you about your voice?
Well, the one speech pathologist thought I was a stutterer.
Mm-hmm.
And,
Did you have a stutter before?
no.
Did you tell him what you thought?
Yeah, I did. And they said, well, we'll just work with you. And then they wanted me to use vocal fries. And now I'm finding out that that's probably one of the worst,
Yeah.
not the right thing to do.
Vocal fries. Tell us what that is.
The vocal fry is taking like a vowel sound and moving it into your lower larynx.
Could you demonstrate what it is?
Yeah. A, E, I, O, U.
Could you count to 10 that way, with that vocal fry?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Where do you feel it? Just point to it.
In my local,
Yeah.
right here.
Right.
Yeah.
Did it help you doing that?
No, it actually made it worse.
Did you tell your clinician that?
Yeah, I did, but she told me it would get better and that I should start reading in a vocal fry. So I would do a lot of my research work reading in a vocal fry. And it kept getting worse. Eventually I just quit going because it didn't help.
Mm-hmm. Then what did you do?
Well, I went back to the doctor that did my tonsillectomy.
Mm-hmm.
And I said, what's going on here? And he wasn't sure. And he checked me for allergies and told me I had food allergies.
What was the relationship between food allergies and your voice?
Well, I had postnasal drip and I couldn't get rid of the hacking cough. And he thought that might be why I had this viral type.
You had a cough?
Yeah.
A hacking cough?
Yeah.
A cough is quite often related to talking in the lower throat. That's what you were doing. I wrote that in the textbook called Modern Techniques of Voice Rehabilitation, 1973. Nobody told you about it.
I don't think they knew.
No. Do people tell you it's hard for them to understand you?
Yes, they do.
What effect does this have on you personally?
Well, it makes me not want to talk to people. And it makes me more withdrawn than I normally would be. I'm rather extroverted, and I love being around people, and I grew up in a large family, so I love to talk. And I stopped talking and I started listening.
Has that a negative, severe negative impact on you?
Of course it was.
Mm-hmm.
I wanted to be a teacher, and to teach you have to talk.
Mm-hmm. What did you do after they told you it's food allergy? Did you have tests?
Oh yeah. Yes, I have food allergies, I do. But it didn't help.
What did you do after that for your voice?
Well, I consulted, well, I went to my general practitioner, and he told me that it was psychiatric,
Mm-hmm.
and that I should go see a psychiatrist. So I went to see a psychiatrist.
And? Hi, we're in studio right now, and we're going to give you the new voice of Sylvia on The Sally Show. Let's run that, please. We're going to run it in just a few seconds, but you're listening to a young lady who's been told that her problem is incurable. She sought help for 34 years, and she essentially gave up, but she had hope. And we're ready now to roll a new voice. Let's roll it.
Have Jimmy James return in a few minutes. But first, our next guest defied all the odds. She says for 34 years she didn't have a voice. And she's been working with this gentleman, Dr. Cooper, for about 4 weeks, and now really can talk again. Sylvia, you're going to talk, but you're going to talk the way you talked for 34 years. I think it's important that we hear the difference. What happened? You were 18, and what happened?
Well, I was 18 years old, and I had a tonsillectomy. And after the tonsillectomy, my voice got worse. I got a virus, and I got sicker and sicker. And by the time I got rid of the virus, I didn't have much of a voice. It would come and go. Sometimes it would almost be normal, but most of the time it was never normal.
Doctor, what is that called?
It's called the strangle voice spasmodic dysphonia.
And what causes it?
The talking in the lower throat. My take on it is that it's misuse and abuse. The medical community is saying it's an unknown cause, and they look to medical or neurological cause, and I'm reporting cures of this condition for over 25 years.
Okay.
By direct voice rehabilitation. It's a different approach.
She's such a beautiful woman, and she sounds like a very old woman.
Yeah, when I spoke with her by phone when she called.
You thought you were going to talk to somebody who's what?
120.
120. That must be very embarrassing. I would think so. How did you find the doctor?
Well, I went through 34 years of searching. I tried absolutely everything. I went to every doctor imaginable.
It's like I'm talking to a different person.
You are?
Oh, yeah.
You are?
Oh, that's so scary. So you tried everything. I'm sorry.
And as a last resort, I had tried botulism 4 times. And after I had the Botox treatments, my voice got worse. It got so bad that I was only able to whisper. And I thought, what else? I have no recourse. And they wanted me to come back for additional Botox injections to adjust the dosage, but they'd already adjusted it 3 times. And it just got worse. So I decided to go with the maverick over here, Dr. Cooper. And I thought, what else do I have to lose? 34 years, and I had nothing to lose.
She is so pretty that she was in beauty pageants, but you didn't have to speak very much, did you?
Oh, yeah, I just walked on stage, and they said, hey, she looks good.
That's it.
Let me add something, Sally.
Sure. Dr. Mort Cooper's the author of Stop Committing Voice Suicide and Change Your Voice, Change Your Life. And he says he can change anyone's voice. What do you want to ask him?
Oh, I don't want to ask him anything. I'm just saying that after 4 weeks, My personality is back. I had become withdrawn, reclusive. I had gone to psychiatrists, acupuncturists, every kind of doctor you could think of. And all of a sudden, when I got my voice back, it's like, hey, the old girl's back, look out.
What's your most common voice problem?
The most common voice problem is a tired voice, a misused voice, it fatigues. But she had no voice. I told her when she called me that I believe I can help her come in. And she tried everything. Her speech therapist wasn't able to help her. She heard me at a medical conference, and she referred her in. How long did it take me to find your real voice?
Well, it took my real voice, he picked up in about 5 seconds. Really,
I have
honest to
somebody
God.
for you. Can you, we have somebody who would like to change her life. Her name is Kelly. Do you think you could help her?
If Kelly wants to change, I believe I can help almost everyone.
Ah, okay.
The individual has to want to change. If they find that the voice is rewarding for them, and...
I think she wants...
Hi, we're back in studio, and we're listening to a remarkable change of voice, as you've heard. What's fascinating in my field is that the medical profession is positive. They're well-intentioned. They're positive. There are no cures, and they guarantee there are no cures of spasmodic dysphonia. I have a number of documented cures of spasmodic dysphonia from UCLA Medical Center, from Scripps, from you name it, University of Michigan, I believe, and so forth and so on. My position is very clear. Patients should get choice of treatment when they don't find the answer with Botox. I have no argument against the Botox because most people want something done to them, and Botox gives them that opportunity. But when it doesn't work, there should be choice. My field doesn't give choice. They guarantee there are no cures of the condition. The word cures is pejorative. It's a negative to them. I report cures, and I use the term cures because there are cures. There are a number of the cures, and I'm just asking my field and the medical field to open discussion, and let's exchange views, and let me show you how spasmodic dysphonia can be cured. I'm sorry to use the term, but it's meaningful. It means that it's not a medical problem, it's not a neurological problem, because I can't change that. Back to the interview, the original interview with this young lady, Sylvia. You notice when you laugh what happens to your voice?
It goes up.
You've been with me one day.
Yes.
You came in yesterday. You're spending a month with me.
Yes.
You've had 4 speech pathologists work with you.
Yes.
Has any one of them helped you with your voice to bring it back to normalcy?
Not over long term. I think it improves slightly with breathing techniques, but they never cleared up the problem.
You've had some botulinum toxin. I'll just explain that to the audience. Botulinum toxin is the state-of-the-art and treatment of choice in the medical community among ear, nose, and throat doctors for the strangled voice. It's called spasmodic dysphonia. It came in about 10 years ago, and it's the rage. It's called Botox. I understand it's failing all over Europe now, and I personally, from clinical experience, find it fails quite often. We'll just find out from